we have strong data about the role of the composition of the microbiota in influencing the response to immunotherapy in diverse cancer types, including RCC. We have data about the possibility of modifying the composition of the gut microbiota through dietary interventions in RCC, but they are, as of today, just only single-arm phase 1 or 2 trials. We didn't have yet a study about randomized study about the transplantation of the microbiota in patients undergoing immunotherapy in RCC. We have some trials with fecal microbiota transplantation in melanoma cancer patients, where there are preliminary signals of the possibility of restoring the response to immunotherapy. And the key innovation of our trial is that it's the first one randomized with FMT, so with the transplantation of fecal microbiota in kidney cancer patients. Yeah, we enrolled 50 patients, metastatic RCC, treatment naive, that were eligible for standard first-line therapy with axitinib plus pembrolizumab. They were randomized 1-to-1 to FMT from a donor, which was an immune responder RCC patient, or placebo. FMT were performed at 3 different time points and with different approaches, and this is another novelty. The first one by colonoscopy at the beginning of the treatment, so at baseline within 8 weeks. The second and the third by frozen oral capsules, so orally, after 3 and 6 months. And the patient donor was almost 60 years old man that started nivolumab plus ipilimumab, so an immunotherapy for more than 60 lung metastases, achieving a complete response that is long-lasting more than 5 years as of today. And the characterization of his microbiota is currently ongoing. Yeah, our study was designed to detect at least a 20% absolute increase in the 1-year PFS. And these are preliminary results because we have data as of today of 44 patients with a minimum follow-up of 1 year. But they are quite impressive because the PFS rate at 1 year is around more than 66% compared to 35%, so an improvement of more than 30%. And even more, we found almost double overall response rate and a quite huge drop in the rate of patients' primary progressors, because they are 8% in the experimental arm compared to 28%. The overall survival data are still immature as of today, but the curves are pretty nicely diverged. So we are hoping to confirm this data with a longer follow-up. The procedure was really safe. We had no adverse events related to the transplantation procedures and in the experimental arm. And furthermore, we have the same rate of severe adverse events in both groups. So it means related to axitinib plus pembrolizumab. So it means that the transplantation procedures were not responsible for an increase in the rate of toxicity. This is pretty great data for us. First of all, we have to absolutely characterize the microbiota of the patient. And we collected the feces and blood samples of the patients at baseline and after the FMT. And so our goal is to try to identify the way the microbiota changed and how it is correlated with the outcomes, with the clinical outcomes for sure. I'm not pretty sure that only one component, I don't know, Akkermansia rather than bifidobacterium, could only one being responsible for the increase of immunotherapy activity. but probably the answer will be the analysis of the metagenomic composition and try to design a new study based on these characteristics as at least the stratifying factors. I do really believe that microbiota is a crucial factor in influencing the response to treatment. I do really believe that somehow the use of antibiotics should be strictly evaluated. I do think that the diet should be another factor to take into account. So reduce the consume of alcohol, stop smoking, a Mediterranean diet, because they are all factors that positively influence the composition of the microbiota. I guess that in the future we should be able to discriminate those patients with a good microbiota from those with bad ones that probably need a support. I don't know if it will be with a transplantation or with live bacteria supplementation, but I think that this is the microbiota composition is a key factor in influencing the response to immunotherapy.